Hi, this is Dr. Kinga Porter from Whole Health, and I wanted to wish everybody a very happy new year. It is time to make those New Year's resolutions, and I know a big one for everybody is weight loss. So during this month of January, I'd like to make weekly videos on how to help you on that journey. This week's topic is going to be diets. Now when I describe diets, I don't necessarily mean something you're gonna start for a month or two and then go back to your old habits. I mean, I would like you to find some lifelong changes that you are able and willing to make to lose weight, feel better, be healthier, prevent chronic disease, and be able to maintain that lifelong. There are several diets that I often recommend to patients, and we're going to touch upon a couple of them. We're going to talk about the paleo diet, the keto diet, the Mediterranean diet, and then short intermittent fasting. So paleo diet, for starters, was initially developed to sound like the caveman diet. So it's meant to eat like a caveman, so no processed foods, very limited on grains, and no dairy. It's mostly high fat and high protein intake, and that has been shown to be beneficial for people with autoimmune disease. It's been shown to help people with GI problems. The biggest reason it helps with people, especially for irritable bowel or IBS, is because the lactose is taken out, and the lactose is a big issue for a lot of individuals' stomachs. The second diet I'd like to touch upon is the keto diet, which is huge right now. It stands for a ketogenic diet, and the basis behind that is that on a daily basis, our body uses our fuel source for energy and for using all the sugar to metabolize that into all the metabolic processes and food and energy. So instead of taking sugar that we take in and converting it into energy, when you deprive the body of sugar or glucose, your body goes into a ketogenic state, and in that ketogenic state the body uses fat as a source of energy. And when it's using your own fat for that, then you tend to lose a lot of weight. Now the ketogenic diet does not restrict dairy like the paleo diet does. And it is a very high-fat diet. It usually represents about 75% fat, 20% protein, and less than 5% of carbohydrates. This diet tends to do very well for people with type 2 diabetes. It's usually not recommended for patients with type 1 diabetes on insulin because it can cause them to become hypoglycemic. And it has very good weight loss effects. The third diet is our Mediterranean diet. The Mediterranean diet is the most often studied diet. It is the diet that's been looked at for cardiovascular disease, both heart attacks and strokes. It's been shown to decrease the incidence of those. It's been shown to decrease the incidence of inflammatory markers, some cancer markers, gut dysmobility. So it's been shown in research to have a lot of beneficial effects. The Mediterranean diet is actually named after the diet that people in the Mediterranean areas eat. And this was initially studied because they saw such a low incidence of patients with chronic disease there. So it is a diet full with protein, lots of healthy fats and lots of healthy oils, and low in carbohydrates once again. Then one question I get a lot is how about short intermittent fasting? We have some good studies showing that short intermittent fasting, and that can be done in various ways, can actually reset your metabolism. It can reset the insulin spikes and the glucose spikes, and it can help a lot with weight loss. Short intermittent fasting is something you can do in conjunction with any other diet you're doing. It is recommended in regular lifestyle to actually fast for about 12 to 14 hours a night in order to have optimal leptin levels. Leptin is what regulates your metabolism, and with short intermittent fasting you can do a day or two of fasting. So that is the conclusion of today's segment on diets. We will have further segments. Our next segment is actually going to be on exercise, and I would encourage you to sign up and share this video and follow us to get updates on further videos. So we'll see you next week to discuss exercise and what's best for you.